want to wish our little sister Daphne a happy birthday.
Happy birthday, Daphne.
She is 21 years old.
Woo.
And we love her a lot. We love you a lot.
Love you.
Most days. So this video that we're posting this week is about the HSG.
Yep.
How did you feel? Like, what were you doing when I was in the procedure?
So I pretty much just sat out in the waiting room, just looking at my phone, watching some sports and reading something. So that was it, really, for about 10 minutes, as long as it took.
You're lucky.
Yeah.
Get off of work and go watch sports while I have a catheter put up me.
Yeah, up in your lovely lady parts.
That's gross.
Yeah.
How did you feel? Like, were you nervous at all about the procedure?
No, I wasn't worried about the procedure. I was kind of more worried about the results, honestly.
Oh, yeah.
Knowing if there was something wrong with any of the fallopian tubes, or the way the urethra was
Not
made.
My urethra. My uterus.
The uterus, sorry.
That's okay.
You can cut that out.
I know what you meant.
I was worried about your fallopian tubes. I was worried about your uterus, how it was shaped.
Yeah.
Those are the kind of things the doctor went over with me about it after the procedure was done. So yeah, that was what I was worried about.
Yeah, I think I was worried about that too. I was actually really nervous. So I could not sleep the night before the procedure. And not only I was anxious all night. It was actually really hard for me to sleep at all.
Yeah, you tossed and turned all night, really.
And so I thought I was going to sleep during the procedure, which is actually, I was hoping I would, but when they put the catheter in me, that did not feel good. When they go to put the catheter in you, they're like, you're gonna feel a little bit of pressure. And whenever a doctor says you're gonna feel a little bit of pressure, that would be like me swinging a hammer at your head and being like, okay, you're gonna feel a little bit of pressure.
Yeah.
I woke right up. That hurt. And that's the only part of the whole day I remember because I was on medicine. But this is a procedure that everybody needs to have done after you've been trying for, I would say, at least a year. Or if you've been diagnosed with other infertility stuff, such as PCOS or endometriosis or anything like that, you need to get in to see a specialist is what I would recommend. This HSG test is a base test is what they told me. And we were actually supposed to do it at the beginning, but I wasn't too concerned. I don't know why I wasn't. I mean, I should have been. This is something that you should do, especially with PCOS, because you can develop cysts in your body. And those cysts will go into your fallopian tubes, they'll go into your uterus, and that could be what's preventing you from being able to have kids. But I mean, that's a really important part of your body to know that everything's okay with, right?
Yeah, you could go month to month, year to year, and have this going on and not even knowing. And this test actually shows you, okay, your left or right fallopian tube is open or not open, and that can be an indication as to why things are not happening the way they should. So it's a good test, really, to make sure. It's important. Oh yeah, it's very important. It was very.
At least
very good information to get.
Yeah, and I feel better knowing now that there's nothing wrong that way.
Right.
In fact, all of our tests have come back normal so far and above average, so we still can't figure out why we're not getting pregnant.
I don't know.
Maybe we just didn't read how to do it right. I don't know.
I missed 8th grade health. I don't know.
I don't know. Something's happening. So no, but we're gonna figure it out. We're gonna figure it out. And so far, everything looks really good. At the end of these segments with the doctor, I am going to show you guys my test results and go over them with you. That's something else that they do starting out. They test both of you.
Yes.
Because there's no point in spending all of this money if it's not even going to work.
Right.
So Ammon has his test results It's one test for him. It's not even hard for the
Nope.
guys. So go in and do it.
Very easy.
Very easy. And my test, the girls' test, there's a lot more to it. They test for hormones. They're testing for egg quantity and supply and all that other stuff that I'm about to go over with you. So stay tuned.
Good luck.
Of course. And then he's going to put in some speculums, just like a normal pap smear.
Okay.
Then he's going to clean your cervix off with some betadine or iodine. You're not allergic to that, are you? Okay,
No.
not that you know of? Alright, perfect. And then he's going to put a little catheter in your cervix and insert some dye into there too, just to make sure that your fallopian tubes aren't blocked.
Okay.
And that's pretty much it. It usually takes, I don't know, just depends on the person. They're pretty quick for the most part, not too painful. So yeah, you took Valium. It looks like you're good on that. So you should be pretty good with pain.
Okay.
So when you're ready, just get undressed from the waist down. Have a seat up here, and then you can drape the little drape over your lap. You don't have to put your legs in them yet, because Dr. Swellstad and I will come in, and he'll kind of explain the procedure before he does it, and as he's like going to.
Okay.
All right? Do you
Yeah.
have any questions?
Can he be in here until you started or no?
Yeah, he can be in here. We'll come back in here, explain everything, and then just right as we're about to start, we'll just have him step out just because of the radiation.
Yeah.
And then once we're all done, we'll invite him back in and go over your results with you.
Okay.
Okay?
Okay.
Anything else?
So this won't. So we're going to do a shot for it to trigger, because my brain doesn't make the hormone to release the egg.
Yeah.
This doesn't affect any of that, right?
No, it doesn't affect any of that. Yeah.
Okay. And you're putting dye in me. Am I gonna pee weird for a
No,
while?
you won't. The
Okay.
only thing, like, kind of weird or unusual that might happen, which is, like, common, it happens to everyone, is you'll just leak some of the dye for a little bit. It's kind of like a stickier dye that he's inserting into your cervix. So you'll just probably leak some of that for, like, a few hours, and then some of the betadine, which is just, like, a brownish color. And then we'll just have you wear, like, a pad home, just so it doesn't make a mess. So.
How long does it take before it comes all the way out?
Just like a few hours. It doesn't.
Oh,
It doesn't affect anything. Yeah, you'll be fine.
Oh,
within,
okay.
like a few hours.
Okay. And it was saying something about like bleeding. Is that how long does that go for if it happens?
If it happens, he usually likes it for it to stop before he does the actual procedure. The only time I've ever like seen bleeding or been in here with bleeding is when he's having a hard time like putting the catheter in the cervix, and so he'll have to like grab your cervix a little bit with the, not really the scissors, but the little tool that he uses.
Okay.
But that's only happened like once when
Okay.
I've been here, so
Okay.
should have no problem. Hopefully have no problems with that.
So then he's just gonna follow it with an X-ray.
You'll be able to see everything right there too. I'll put a little marker on your tummy just to determine the right and left side.
Okay.
So you'll be able to see everything on there, like if you want to look while he's doing it. And then he'll go over everything with you, like on the x-ray too. So you'll be able to see it.
Okay.
Okay?
Okay. Cool.
All set?
Yeah.
Okay.
Thank you.
Yeah, no problem.
Why are you laughing?
Butt fish. I changed Rachel's phone and I put on a butt fish. Butt fish.
The right one showed that it was normal. The cavity showed that it was normal as well. So right tube open, normal cavity. The left one took a lot longer, but it is open. So I'll show you those pictures now over here. You can see the lower catheter here. Nice triangular cavity. This right tube, as you can see as I go along, I'll kind of go quickly so you can see it. Tube goes like this. This tube is open, can see the contrast coming out down here. This left one, it's now starting to show it's there, but it's going very slow. Then it goes up this way and it kind of stopped. I had to get more contrast to put in. Once I did that, a lot of it started to come out the end. So it's just slower to open, but it is. Nice triangle cavity. I do remove this balloon so you can see that lower aspect right there. You can see this. This looks beautiful. Really nice triangle. Both tubes are open. That's it.
Okay. Awesome.
It's good. It's good. It's good overall. It just took longer because we had to put more contrast in. This
is the front page to my ovarian reports. To get this report, they take a bunch of blood samples and make up this chart to show you where you're standing with all of your hormones and egg supply and egg quantity and all of that stuff. This next page is an overview of all of the tests put together, so it's a comprehensive package, which your doctor, when he runs this report for you, should be able to go over all of it and go over all of the levels and show you where you fit into each category. So on this page, you're going to see a bunch of different hormones labeled across the top. So from left to right, FSH, I am a 7.1, as you can see, and that measures your quality of egg. The estradiol, however you say that, mine is a 38.0, and that's where they measure your estrogen. My estrogen is lower, and that's actually really common in PCOS. AMH is very important. That is going to be how many eggs you have total. That's actually based off of age. AMH is also, it's based off of a couple different things, and I'll go over that in a second. That's the next chart we're going to go over. But essentially all of these tests together give them a comprehensive view of what you're going to be in your category. So here we have the AMH chart. Low AMH is associated with premature ovarian insufficiency, earlier menopause, and autoimmunity, whereas high AMH is associated with PCOS and later menopause, which is the category that I fall into. The ESS test is the egg supply score test. It's calculated based on age and AMH and FSH hormones, and it determines the quantity of eggs that you should have. On the right side, you'll see the egg quality, and that is determined on age. Now, that's not a random number there. This test is based off of 26,125 women who did studies in an infertility clinic. Well, there it is. So we hope you guys enjoyed this, and if you didn't enjoy it, we at least hope it was informative.
Yes. Honestly, thank you for all the viewers, subscribers that we've gotten so far and will receive. Yeah, stay tuned. We'll have a lot more information and good videos to show you. Thanks.
You guys are awesome. If you have any questions, feel free to go ahead and post them in the comments or write them down. Obviously, we have to go to the doctor every month, so if you have questions about infertility that you want to ask, go ahead and post them down there, and I'll be sure to ask on my next doctor appointment. Also, we are bad kids and we forgot to wish my dad a happy birthday. It's his birthday this month.
Happy birthday, Dad.
So we love you, Dad, and happy birthday. And that's it.
Yep.
Yep, that's it.
Great.
See you guys.
See ya.